Did you know that dark spots from acne and injuries can linger for many months or even years without the proper care and management? Hi, I'm Dr. Angeline Yong, board-certified dermatologist and dermatological surgeon, and today I will share with you on how to prevent and treat post-inflammatory hyperpigmentation. So what is post-inflammatory hyperpigmentation, or PIH for short? So this happens when excess melanin is produced as a response to inflammation in the skin that can result from something simple as acne, eczema, or a form of injury. This typically happens more commonly in darker skinned individuals, such as those of Fitzpatrick skin types 3 to 6. First, let's talk about skincare for PIH. 1. Sunscreen is non-negotiable. Use a broad-spectrum sunscreen with adequate SPF protection, at least SPF 30 and above, to ensure that further UV rays do not cause further stimulation of post-inflammatory hyperpigmentation and further darkening. 2. Ensure first that the underlying problem that produced the PIH is adequately controlled. For example, if PIH was caused by active acne or actually caused by active eczema, do ensure that you use the right skincare options as well as prescription creams to manage this condition first before trying to embark on lightening the PIH. So here are 5 essential ingredients that can be incorporated in a skincare routine suitably to ensure that we clear PIH fast and effectively. First, vitamin C, which is a potent antioxidant that is very useful at quenching free radical stress in the skin and minimizing post-inflammatory hyperpigmentation, brightening the skin, and overall improving and evening in the skin tone complexion. 2. Niacinamide, which is good at stabilizing the skin barrier, minimizing the stress to the skin, and also improving its cellular recovery. 3. Retinoids, which is a vitamin A derivative. This encourages cell cycle turnover, exfoliation of the skin, and fading of the post-inflammatory hyperpigmentation. It also does suppress melanin production at the same time. 4. Azelaic acid, an anti-inflammatory ingredient that is very helpful at brightening the skin and also improving cell cycle turnover. It's a very useful option for patients who battle both active acne as well as post-inflammatory hyperpigmentation from acne, and may be a safer and gentler alternative to those with sensitive skin than retinoids. 5. Hydroquinone, a very potent bleaching agent that can be used to fade discoloration and pesky pigment spots. However, do seek medical advice before starting on hydroquinone to decide whether it is the suitable ingredient for you. If topical treatments are not adequate at lightening this effectively and quickly enough, then there are certain in-clinic procedures that can be embarked on to further improve your discoloration or hyperpigmentation. First, there are options like chemical peels and microdermabrasion that can encourage cell cycle turnover and fade hyperpigmentation, exfoliating the skin at the same time and promoting increased skin radiance. There are also other laser or light options. For example, there can be kill switch lasers or picosecond lasers that can be very effective at targeting these unwanted pigment spots. The choice of treatment modality depends not only on your lifestyle but also your skin type and what the PIH was caused by. So sometimes when the PIH is due to acne, then maybe a chemical peel might be really useful, because chemical peels can also effectively suppress acne formation, encouraging a cell cycle turnover, exfoliating the skin, and also preventing sebum production. So this might be a very useful choice for somebody who's still got some active acne and also needs to treat acne PIH. On the other hand, a patient with eczema or very sensitive skin like rosacea, for example, may not benefit from chemical peels because they might be too sensitive to undergo chemical exfoliation, and for which then targeted laser treatments on the pigment spots might be more suitable choice for these individuals. If you're not sure what treatment is the best choice for you, consultation with a board-certified dermatologist can be very useful because it can take into account your underlying medical skin condition as well as the biology of the skin and skin type before deciding on the correct treatment paradigm. Most importantly, patience and consistency is the key to achieving the results that you want. So whatever treatment modalities you choose, if you stack too many strong products like hydroquinone and other lightening agents together or do aggressive treatments, it can actually backfire. Hence, take it slow, be consistent, and step up your regime based on tolerability so that your skin doesn't get stressed, oversensitized, and then develops further PIH as a result of that. So if you like the above video, don't forget to like, share, and subscribe to our channel for more interesting and up-to-date dermatological content.